Great. Well, good afternoon, and thanks for joining us, everyone. My name is Kate Shamzad, and I'm the Senior Program Officer at the New Jersey Healthcare Quality Institute. The Quality Institute is a multi-stakeholder member organization that convenes healthcare leaders in New Jersey around the common goal of improving safety, quality, and affordability of healthcare for everyone. A public health crisis, such as the one we're facing with COVID-19, tests our strengths and highlights our weaknesses. At the Quality Institute, we are continuing to have important conversations about today's toughest healthcare issues remotely via webinar, quality briefing, and other valuable resources like today's presentation. We're getting through this together by communicating best practices and learning from each other. We're honored today to partner with our member, the Garden State Pharmacy Owners, to bring you this presentation. I just want to go through a couple of housekeeping items. Please know that this webinar is being recorded and a copy will be posted to our website, njhcqi.org, later today. All of your phone lines will be muted for the duration of the program to limit background noise. However, you're welcome to ask questions throughout by typing into the chat box. We'll answer the questions at the end of the presentation. The topic for this presentation is best practices during COVID-19, pharmacy safety and access. By the end of this webinar, we hope that you will have learned strategies to mitigate COVID-19 transmission risk within a community pharmacy, alternative methods to safely access prescriptions, and potential long-term effects of COVID-19 on medication access. Please be advised, however, that it's not the intent of this program or its speakers to provide clinical or legal advice. Today, we're honored to have Brian Oliveira, PharmD and Executive Director of the Garden State Pharmacy Owners, as the expert speaker for this webinar. Brian is a 2009 graduate from the Ernest Mario School of Pharmacy at Rutgers University with a Doctorate of Pharmacy degree. He's acting president, clinical director, and pharmacist in charge of Baker's Pharmacy in Sussex, New Jersey, where he's been from 2010 until now. He was elected to Garden State Pharmacy Owners Board of Trustees in 2016 and was announced as the new executive director in April of this year. Without further ado, I'd love to turn it over to the presentation to Brian, who will be discussing the pharmacist's role during COVID-19 and best practices for keeping staff and patients safe. Brian, it's all yours. Still on mute.
Perfect. How's that? So thank you. Good morning, everyone. I want to first start by thanking the New Jersey Healthcare Quality Institute for having me. I'm really honored to be here today, and I'm very excited to be able to share in my experience, not only practicing, but operating an independent community pharmacy during a situation like COVID-19. Before we start, I really need to take the opportunity to go ahead and apologize to anyone that gets nauseous easily. And what I mean by that is that while preparing for today, my wife reminded me several times that I tend to be fairly animated when I speak. So I'm going to try to really stay in frame and keep my hand gestures to a minimum. I'm going to do my best to do that. So with that out of the way, I'm going to give you guys some quick background on Garden State Pharmacy Owners, or GSPO for short, who we are as an organization. We're a member-based organization that's dedicated to promoting the continued success of independent community pharmacy in New Jersey. We were founded over 30 years ago, and we fight the good fight, so to speak, for issues like patient access and countless others in both the state and federal legislative arenas. And we also provide various business solutions to our members, different incentives for vendor programs and clinical programs that are easier to install in their pharmacies and so on. I've been involved in GSPO for a few years. As Kate mentioned, I was a member of the Board of Trustees, and I signed on full-time just a couple weeks ago. But before that, I spent the last 10 years of my career as owner and pharmacist in charge of Baker's Pharmacy in Sussex. If you've never heard of Sussex, New Jersey, it'd be pretty hard to blame you, as it's a 1 square mile area that is totally surrounded by Wantage Township. It's part farmland, it's part mountains, and if you really didn't know any better, you probably think you were in Vermont. But as Kate mentioned, I'm a proud graduate of the Ernest Mario School of Pharmacy at Rutgers University, and it's fairly hard for me to believe it's been over a decade since I graduated. It makes me feel pretty old, but it probably would have been harder for me to believe back then that I'd eventually end up presenting a webinar on, of all things, pharmacy pandemic preparedness. But here we are. So we're going to start quickly by reviewing today's objectives. We can get to the next slide, please. So just a quick explanation on the photos you guys see in front of you. The red door up top is the main entrance to Baker's Pharmacy up in Sussex. And ironically, it's the only part of the pharmacy that our patients have been able to see for the past 2 months or so, as we have been under closed door protocol, which we'll get into since about March 20th, I believe, which was a Friday. And the sign you see below, hanging on the window, was actually taped to the outside of the same window you see with the American flag. And if you can't read it, I'll try to read it for you. It says, "Thank you for being here. Stay safe. God bless." And that was actually put there by a local hospice nurse. And I got to tell you that it couldn't have come on a better day, as earlier that morning we received some bad news about a patient that passing away from COVID. So little things like that went a long way to boosting morale for our staff. And if anyone has any experience, working on the front lines during the situation, morale can tend to be an issue. So I just wanted to thank her for thanking us. It was a great thing to be able to look up and see that in the window. So just wanted to quickly share that. So among our topics for discussion today are going to be different strategies that can be implemented to help lower the risk of transmitting SARS-CoV-2 within a community pharmacy. And just for clarity, since there's a lot of misinformation, SARS-CoV-2 is the actual virus that causes the disease we know as COVID-19. The full name of the virus is actually Severe Acute Respiratory Syndrome Coronavirus number 2. You can see why they try to abbreviate these things. And according to the CDC, the CO in COVID-19 stands for corona, the VI for virus, and the D for disease, 19 obviously being the year was first documented just last year. And because of that, we're still in the very early stages of understanding this virus, how to treat it effectively, how to prevent it. We are luckily have a good understanding of how to contain the virus and how to stop its transmission. But even with mandatory shelter-in-place orders nearly everywhere, the numbers have been still staggering. And the concern, obviously, is that this is not a one-time affair. There might be a corona season, which we'll discuss in the future. So more appropriately, whenever we're talking about lowering transmission risk, it's more appropriate to talk about the virus itself with the overall goal of fewer cases of COVID-19, or as few cases as possible. So we're also going to be reviewing some alternatives to the traditional retail model, with the goal of hopefully giving our patients an overall safer access to their prescriptions. It's very worth noting that we're totally in uncharted territories as a healthcare community and as a society. There isn't really a single gold standard when it comes to how to approach a pandemic in community pharmacy. Every single healthcare practice setting is unique. Every set of employees, every staff setting is unique. And even with overlapping field of practice, retail pharmacy, you would think that retail pharmacy equates to every other store, but that's not the case. What worked at our pharmacy might be all but impossible to employ in a pharmacy down the street, and vice versa, for a variety of reasons. And so we're going to take a closer look at some great examples of suggested best practices for community pharmacies and even some medical offices. And we're going to discuss how and why we ultimately decided on a curbside model at Baker's. And last but not least, we're going to take a look at our crystal ball, so to speak, and try to review some long-term effects of this health crisis on medication access, specifically at the community pharmacy level. So next slide, please.
Brian, your video is a little off and on. If you wouldn't mind just stopping your video and then starting again, let's see if that helps a little bit.
Absolutely.
Maybe a
Hopefully
little.
this is better.
Maybe a bit, but we can hear you just fine.
I'm going to get off Wi-Fi on my phone. I'm not sure if that'll fit. Let's see if that helps. Okay. So when we talk about the timeline of COVID-19 cases in the US and even more locally in the state, the first confirmed case was all the way back on January 20th in Washington state. And by March 18th, less than 2 months later, the coronavirus had already made its way into every corner of New Jersey, across the entire continent, and even into our quaint little county of Sussex, one of the least densely populated counties in the state. And literally within hours of the press release from the Sussex County Health Department, I started fielding calls at the pharmacy from local leaders looking for guidance and curious what we were doing as a pharmacy to help protect the community, as we were the major source of healthcare in our area. And my answer at the time was very simple: I'll have to get back to you. I mean, luckily I was only half joking. We did sort of have a plan. We actually had already started disinfecting high touch surfaces more often than our normal cleaning routine. We provided basic personal protective equipment, or PPE, in the form of N95 or KN95 masks, depending on what was available, and gloves to our staff. But we quickly realized that the risk to our patients and our staff and their families was not a threat anymore. It was an immediate risk that was at our doorstep. And even though Sussex is not densely populated, it doesn't have that many people, unfortunately, fortunately, the communities are very close-knit. And actually, 2 of the first 3 cases in Sussex County were patients of mine. So you can see why the local concern was fairly high there. And it quickly became clear that we needed to sit down and prioritize and come up with a plan to do everything within our power to lessen COVID-19's impact on our community, our patients specifically, and our staff. And from that initial brainstorming session, we developed 2 main priorities or goals that you see on the screen that we felt were most important to address. The first being that we needed to make sure that our patients had totally uninterrupted access to the prescriptions and our medication therapy management, or MTM services. For those unfamiliar, MTM services are essentially what pharmacists do on a regular basis, but they can actually be a little bit more intensive, in the sense that we involve some more enhanced communication with prescribers to try to optimize therapies more than just checking for interactions and so on. We felt we could achieve this primary goal first and foremost by kind of refocusing on the health and safety of our pharmacy staff. As a pharmacy owner, I can tell you that the staff is far and away our #1 asset. And as the first bullet point on the slide indicates, we believe that a safe staffing environment was critical to maintaining our community's access to our healthcare services. So quite simply put, if we got sick, there would be no one around to serve the need of our patients. And so we needed to make sure we took some steps to try to make sure that didn't happen. Beyond the safe staffing environment, we tried to look at any measure, any way, any idea we had or could put together to try to help to make sure our patients could continue to get their medications on a timely basis. We were fighting some drug shortages on the market, and the throwing a closed door protocol that no one had ever been used to, or no one had ever, we'd only theorized about in the past, further complicates things. So we realized that we had actually already some of the most useful tools at our disposal, and actually had been using some of them for quite some time. And what I'm really referring to is our adherence enhancement programs, or AEPs for short, namely our MedSync and our refill reminder programs. And for those unfamiliar with what AEPs are, sorry, too many letters today. They're essentially programs designed to increase medication adherence. They come in all shapes and sizes. They're usually focused or geared towards patients managing multiple prescriptions, or severely complex regimens with multiple dosings throughout the day, or even those with severe chronic illness, or even people that just want help managing a couple medications. And what we see a lot is we have, kids or that are taking care of older parents. When I say kids, I guess people my age now, that are taking care of older parents that come to us, say, they can't handle it themselves. How do I do this? And so we have different options for them with, MedSync and refill reminder programs, and some different adherence packaging that we'll review. And beyond helping simplify complex medication regimens, AEPs can actually check multiple boxes for a pharmacy during a situation like a pandemic. They can actually be used in great effect as an inventory control measure, because ultimately what you're doing is you're allowing yourself to know what your patients are going to need before they need it. And that extra window of time, it really helps when if something is off the market because of a shortage, because nothing is coming out of China as far as generic medications are concerned. And so that gives you time to reach out to a prescriber, and build that relationship, and be able to hopefully therapeutically switch a drug out with minimal clinical impact for the patient. And so that time frame is really the best asset that these programs can offer. It gives you some extra time, some breathing room to be prepared before a patient shows up at your pharmacy saying, I'm totally out of my medications. I have no refills. I was supposed to be on a plane 5 hours ago, that kind of thing. So we identified our second main priority as wanting to help minimize the amount of local COVID-19 cases. And obviously this is overlapping with the first goal. And unfortunately, as we're all aware, this strain of coronavirus spreads completely like wildfire, and it preys upon the chronically ill. I mean, generally speaking, the most at risk are immune suppressed patients, diabetics, those who suffer from chronic lung conditions, etc. And although the transmission risk was relatively low in Sussex County overall in terms of population numbers, we felt that our specific patient base at Baker's fell into a high risk category in terms of the number of patients dealing with chronic health conditions, and coupled with the county's very limited access to healthcare, especially emergency health services. I know it sounds crazy in New Jersey that patients don't have access to emergency services, but you'd be surprised. I know firsthand that unfortunately I've seen some hospital closures up there in the past decade or so, and it makes it very difficult for patients to have access to emergency care when they need it. So we're very in tune to this. A lot of the providers in the area are already aware of that situation. But when you weigh that limited access against both of our goals, we ultimately decided on moving to a curbside or delivery only model because we felt it was the best way not only to protect our sensitive staff, but our patients as well, and lower the risk for everyone involved. Even though it caused a lot more headaches, it caused a lot more, business issues that you have to take care of when you're putting physical hurdles between your patients or your customers, if you think about it in a business standpoint. But we decided that it was the safest route to go, and that's why we went that way. And I actually think it's pretty important to note that priorities can differ, like I mentioned in the past, for healthcare setting, regardless of overlapping practice, or there's a lot of variables. I mean, 25-year-olds still immune to everything because I just lived at school for 6 years, Brian, probably would have looked at the risks associated with COVID-19 a lot differently than 35-year-old married with a 2-year-old Brian. And that, really comes into effect directly with the type of staff that you have. And just for as an example, another thing to help push us towards curbside model was that, we had 3 of our main technicians who had a significant other that they were living with at home, unfortunately going through chemo. And so it was a situation where we had a really high risk scenario where if one of them contracted the virus, might not have been totally asymptomatic, as we're learning that a lot of patients can carry this disease without ever having any idea. And they passed the virus on to their significant others. That would have been tragic. And so on top of that, we had another technician who essentially has to live on Humira, which is a drug that suppresses the immune system because unfortunately that technician suffers from psoriatic arthritis and essentially can't function without the drug. And so it was a situation where we were putting him in harm's way at all times just for coming to work. So when we really we're not excited about the complications associated with going to a closed door model. But eventually we decided on it for a variety of reasons, including the ones we just mentioned. So on the next slide, please. Perfect. So what we're going to look at now is some examples of some guidance and some best practices that some prominent organizations have released for community pharmacy. The first and foremost being the CDC. Everyone knows who they are, I'm sure. No need for introduction. Let me pull it up on my screen. Apologies. Sorry, I'm having a hard time seeing the slides. So I'm just going to pull up the paper. So these things are basically a summary of some common sense transmission mitigation strategies, if you will, that the CDC released for us, and were really only updated back on April 14th. And some of these things have to do mostly with face coverings. This is a lot of the stuff that a lot of states have actually mandated anyone, especially New Jersey. You know that if you've been lucky enough to leave your house and go to a place of business that is still open, that face coverings are mandatory. So this is more, if you look down towards the bottom where it says implement universal use of face coverings, that's actually a situation that obviously we had already took place or had already implemented in our store before we decided to go closed door. Go ahead and go to the next slide, please. Sorry, I'm just trying to resize it myself here. Okay, so the next bullet point here says advise staff who are sick to stay home. So This is a tough scenario, and especially it was a little complicated at our store because even though we have a large staff, we had 18 plus full-time employees and a handful of part-timers. When when a staff starts to feel sick, obviously the most prudent thing is to instruct them to stay home. But then you quickly leave yourself in a situation where you don't have enough help to fill the 300 plus prescriptions and the overwhelming calls that are coming in from the local community. So what we actually took to doing is to try to work with our staff to educate them to understand what they could do in their personal lives to try to avoid increasing their risk. And that really was more common sense things, trying to sanitize, high touch surfaces in their own home, making sure that their families were aware of the unique scenario that they were in as healthcare workers and the unique risk position that they had, and trying to make sure that they understood the importance of them being able to go to work healthy on a regular basis. So it's just about communication, and it's telling your staff and hopefully having a good enough relationship with them and their extended family that it's really a group effort to try to make sure that everyone stays healthy and can get into work and to be able to help the patients that need us to be there. In the next section, the CDC addresses some suggestions on what we could do as far as filling prescriptions. And a lot of the stuff is actually very useful. I mean, some of it's common sense, again, providing hand sanitizer in a situation where you're still open door. If someone physically hands you a piece of paper, unfortunately, we know that this virus can live on almost any surface and for much longer than most viruses do. So even a piece of paper, a cell phone, an insurance card that sometimes someone can hand, a pen that's on the counter, the signature pad, the credit card pin pad. You have to be aware of all those kinds of contact surfaces and make sure that these things are being disinfected on a regular basis. Before we went closed door, we started doing that as well, but really it becomes, in our eyes, almost a fruitless venture. I mean, we were taking a look at our reports and seeing 250 plus transaction at the register. It became, and couple that with hand sanitizer being impossible to find, sanitizing wipes like Lysol and spray being much more difficult to find. Overall, when all these things were added up on pros and cons, we decided that going to closed door was the best all-encompassing plan. But as far as the process of filling prescriptions, they actually mention here to encourage prescribers to send e-scribes over electronic prescriptions instead of physically handing paper prescriptions to a patient. Now, that benefit is twofold. You're not having a situation where the prescriber can potentially contaminate the patient by handing them a piece of paper or vice versa, or someone at the staff at the doctor's office. And then they come and bring you that piece of paper and say, here's my germs. So it's 2020, and even though that doesn't necessarily resonate with some prescribers sometimes as far as e-prescribing, having communication and good rapport with local offices can help you accomplish that goal. And that goes a very long way to eliminating a big problem, is people showing up to your pharmacy with a piece of paper, then having to wait for that prescription to be filled. Because ideally, when you're talking about a closed door situation, you want to try to have everything prepared ahead of time. You want to try to make it a seamless transition for your patients and for your staff. And so a situation where a patient shows up to your front door with no notice, with a blue piece of paper or bluish green, as there are now, and then they have to wait outside as they stare at you through the window, potentially contaminating themselves with other people that might be on the curb or walking by. There's just a lot of things that could be easily avoided by having the doctor call in, fax us, or e-scribe us the prescription. That way it's ready before the patient gets there. There's less chance of contaminating us and vice versa, less chance of them sitting on the curb. So it's something that, when you work with the local prescribers in your area, it's something that should easily be attainable. And we actually went as far as having patients take photos of their prescriptions if they were, because we were really uncomfortable having my staff try to go out and collect prescriptions, because then you basically, what do? I mean, do you sanitize a piece of paper, then you quarantine it? So we set up a situation where patients were actually taking a photograph with their smartphone, e-scribing or emailing it to our pharmacy. And then if it was a situation where we needed to call the office to verify something, we would just do it with that image. And a lot of things that tie into the curbside model that made this possible were really, Medicare recently released us from the responsibility of having to accept signatures, specifically Medicare Part D, which was a big help. And on top of that, the New Jersey Board of Pharmacy exercised the right to use a waiver to allow us to focus more on filling prescriptions and taking care of our patients as opposed to collecting signatures, which obviously was a big issue as far as contamination. Let's see here. You can go ahead and go to the next slide, please. So I want to address on this slide is in the center section, the use of administrative controls, protocols or changes to work practices, policies, or procedures. I mean, that's essentially what we're discussing here. And to be honest with you, it's a situation that as this is unfolding, it's not, in my experience, a situation where I literally sat down and typed out policies and procedures for my employees. It was something that we were learning on the go. It was an ever-evolving model. We sat down after we decided that we were going to go to curbside, and we explained our goals and why we were doing it. And we basically, at that point, once we were all on the same page, the next step was communicating with our patients. And that might have been the most complicated part of it, only because, our pharmacy has been luckily in the same spot for over 100 years. We've had generation after generation after generation of patients come back to us and use us. And I'm very proud to say that we were continuing to grow as a pharmacy, servicing more patients, having more relationships with prescribers, doing different clinical services, providing them for the community. And so it was a big change to everyone involved. People were just used to showing up at the door and, showing Brian a random rash that they had on their back, just because it was the easiest thing for them to do. And that is, while very flattering, it's something that it took a while. I would say well over a month, even into 6 weeks before we were really in a flow where every one of our patients understood what we expected of them. And we tried to do our best to communicate that. And really all it was we asked you to call ahead. Call ahead to us. Let us know that this is what you need filled if you're not already on a refill reminder or med sync program, because then we would be calling them. Let us know what you need filled. Give us time. If there's a situation where you don't have refills, give us a couple extra days, because prescribers' offices are taking longer if they're even open. So that communication back and forth eventually got into a flow, and it made a situation where really by, I would say, week 5 or 6, it was almost smooth sailing in the pharmacy. That chaos of the first couple of days to weeks where no one really knew what to expect and the patients were all confused and staring at us from the outside of a locked door. Even though we had tried to be preemptive with communications through our website and our Facebook page, it's just a learning experience for everyone. And you have to take into account that everyone has a lot of personal things going on right now. Everyone knows someone that was affected by COVID, if not, unfortunately, lost someone to COVID. And so when people come to our pharmacy, it's never because they really just want to spend some time. So we want to make sure that our staff was aware and keep these things in mind. And that communication is absolutely essential. You need to have open dialogue with your staff. You need to have open dialogue with your community leaders, your prescribers, especially your patients. They need to know what you expect of them and vice versa. And I think the CDC here does a pretty good job of outlining some basic ways you can do that. Obviously, reducing risks of COVID testing. We're going to touch upon that as just yesterday, actually, there was an administrative order announced by New Jersey allowing pharmacists to start performing tests. So we'll address that later on, but we can go to the next slide, please. Actually, this is more of the same. Go ahead. I apologize. We can skip this one. Perfect. Okay. So these best practices you're looking at here was actually a joint effort from a couple different organizations, mainly NCPA, or the National Community Pharmacy Association, and CPESN, just more letters to learn. And so this is a group that actually focuses on having enhanced clinical services for community pharmacies throughout the nation. And they've put together a pretty good list here that I think is, although I could have used it back in March, is something that really summarizes a lot of the issues that we had to face and overcome. So the first thing you'll see here is, again, addressing the protection of the pharmacy and patient workforce. And what we're trying to do really is to determine the main method that we're going to go forward and have our patients receive their medications and every other service that you provide. You'll see under medications right there, the first option, or the recommended one, is curbside and or drive-through only, which is obviously the one that we ended up going through. I wish we had a drive-through. It would have made our lives much easier. But it's still, overall, when you take into consideration the fact that you're limiting a lot of different contamination risks and transmission risks, it's still the safest, although obviously the most difficult to employ. And if that's physically impossible for whatever reason, or if it's a situation where the business decision is made to keep the front door open, and you can make an argument for that as well. You definitely want to start implementing social distancing procedures. And here is where the proper use of PPE is extremely important. And I say proper use because, as you can hear alluded to on a great webinar that was given back in March by Dr. Stavros Christodius, he mentions that gloves can give people a false sense of security, and that's absolutely true. You have to be aware of what you're touching. Just because a glove, you can throw it away, doesn't mean that you can't actually contaminate more surfaces and be unaware of it. So that's why I mentioned the proper use of PPE. And unfortunately, training is usually not something that happens too often, at least proper training. But there are really good sources, including the CDC, to get you some basic training on that. If there's a situation where, you already closed door, as a lot of pharmacies that I'm aware of are, and are making preparations to go open door, reinforcing that training with your staff, even yourself and your patients, is something that can really be beneficial. And beyond the actual pickup of medications and item B, they mentioned the other enhanced services. And so they say, obviously, remote counseling and education. What does that mean? We're not, unfortunately, doing Zoom meetings with our patients, although that probably would get interesting very quickly. But pick up the phone. I mean, it's very simple. We tried to take care of our counseling for our patients, during the conversations that we were having before they even came down to the pharmacy. So when they gave us a call that they had a new prescription or they had a question, any of the counseling was taken care of at that specific point. And then when they come down, it's a situation where the payment's already taken care of, and we just walk out to the front door, hand them the prescription, tell them to stay safe, and send them on their way. And as far as remote ongoing monitoring and follow-up, I mean, this is fairly simple. This is something that we obviously all do on a regular basis. Unfortunately, we don't really have the time to make it to people's homes. So, remote monitoring and follow-up is something that falls right in line with what we should be doing on a regular basis. So that's really simple to take hold of. As far as determining the best ways to decrease potential exposure, there's a lot of different ways and different tactics, and I think some of these are actually fairly interesting. Specifically, item B, setting a timer to remind your staff to wash and sanitize workstations every hour. That's something, you can choose the time frame, but I really think of a physical timer that goes off as something that it actually helps promote very good muscle memory. And it's a situation where everyone is doing it at the same time. That anything that needs to be sanitized was sanitized at what time it was sanitized. And so there's never any doubt. And something like this is something that is very easy to install or instill, and it takes very little effort on anyone's part. Set up a quick timer, but it has a huge effect in the long term. And I mentioned this, or I alluded to the item C earlier: set expectations for employees to follow social distancing and other precautions outside of work. So, we can go through all this, have closed door protocol, teach everyone how to use masks, go through the whole gown, hazmat suit, the whole works. It means nothing if our techs were to go home and throw it all out the window. So this is what I mean, that it takes a joint community effort to keep a pharmacy open. And beyond the people that actually worked at the store, the people they lived with. If they weren't following social distancing protocols, that would create a chain of possible transmission that would end up in a horrible situation for a lot of severely ill patients in our area. So this is something that I feel should be item A on this list, because it's incredibly important that you can do all the hard work, but if it's not being followed through at home, it's not really going to go anywhere. And indeed, we've talked about utilizing PPE. So you just go to the next slide, please. Okay, so item 3 on this list is something that can get a little complicated. And what I mean by that is that having a plan for when your staff is potentially exposed to COVID is not simple, but you need to have one. You need to be prepared. You need to know exactly who to contact. And in our case, I think the most appropriate thing to do would be to contact the New Jersey Department of Health, and also your specific county Department of Health, and let them know what happened. And then obviously the next step would be a round of testing. Depending on what tests are going to be available to us, a lot of different things are going to be coming out in the next few weeks, we hope. But most likely, the suspected employee or someone who might have already tested positive will have to be quarantined, and then there'll have to be some further testing of employees to see if anyone else is carrying the virus. If that happens, obviously, we can no longer go into the store because we put our community at risk. And it's something that is so encompassing. Like I mentioned before, with the virus living on any kind of surface, we really had to even change our mentality of how we even filled prescriptions. It's a situation that, even when we go to take a stock bottle off the shelf, we need to make sure that our hands or whatever we're touching with is sanitized, especially when we're doing our adherence blister packing. So, having a plan to make sure that our staff is able to work from home is almost impossible in this situation. But there are some things that we can try to do, and that's making sure that, there's always a tech off if someone does get sick. But really, I gotta be honest with you, we really just gritted our teeth and prayed that no one tested positive, because it would be a situation where we really would be either extremely shorthanded, or we'd have to, unfortunately, start sending prescriptions to another pharmacy, which would be the safest thing. We could never put our community at risk by just assuming that we weren't spreading the virus to other people. So that's something that can get a little complicated, and staffing in general, and who's available, and who wants to work, who's able to work, people having to take care of ill people at home. A lot of complicated things to address there, but it's something that you need to sit down and at least preliminary have a plan in case the inevitable happens, or the worst case scenario happens. On down towards the bottom part of the slide where it says pharmacy workforce strategies. We've talked about this a little bit earlier, where it says, if possible, move fill dates 2 to 5 days earlier to manage potential drug shortages. So what I mentioned MedSync earlier, or refill reminders. How we handle those programs is, if someone wanted to be on our refill reminder program, we set our computer system to let us know 3 days before they ran out of the medication, based on when they last picked it up. So just for example's sake, if you picked up a 30-day supply of a medication on the 1st of the month, on day 27, it would show up on our system, maintenance medications. We're not talking about antibiotics or things that are one time, but maintenance medications would show up on our system, and we would call the patient. We would confirm that they were indeed 3 days from running out of the medication, that they needed us to fill it, that there was no suspected change in therapy if they were seeing a doctor soon, that they weren't experiencing any kind of side effects that they had not reported to us yet. And so what NCPA and CPESN is mentioning here is that maybe make that window of time, whatever your pharmacy is already doing, make it a little bit larger. And that really makes a lot of sense. Instead of having just 3 days window, if you can go up to 5 days and still have a situation where you're not having your patients running, having overwhelming amount of medications, that just gives you even more time to manage, again, potential drug shortages, contact physicians to get refills in case they are not able to get to work, or there's a situation where they're short-staffed because of the very high likelihood that some of them have to be quarantined, and so on. And so this is I think a very smart move. And when you really capitalize and try to maximize the number of your patient base, that what they're going to need ahead of time, it just makes everyone's life easier. Instead of filling something that a patient doesn't need, our goal as pharmacists is always to optimize therapy. And a lot of times that actually can mean, when we do MTM services, actually eliminating or combining some therapies. And so, MedSync, and, which is actually the process of filling prescriptions all on one day every month for a patient, and refill reminders, which is essentially just calling the patient ahead before they run out of medicine. They can both go a long way to making sure that patients get the meds they do need, don't get the meds they don't, and that everyone is on top of the same therapy, where all the prescribers have a current med list. And it's very effective in our situation now, because unfortunately, because of a number of drug shortages, as I alluded to before, a lot of generic drugs come out of China and India. Having that extra time frame gives you time to hunt the market, so to speak, and make sure that our patients can actually get our meds. You can go to the next slide. So this is actually just a slide about patient communication, which I've actually touched upon a little bit. These are some strategies that are more specific on how you can communicate things to your patients. I mean, a lot of these are self-explanatory, like, using your phone recordings. But I really think a good point to mention is number 2, encouraging patients to refill their normal refill amounts, so that drug shortages can be minimized and patients have access to critical medications. This is huge, because I can't tell you how many news programs and how much the media has pushed, go get your medication, go get it early, you're never going to be able to get it again. And that creates a situation where you send a flood of people looking to their pharmacies, looking for medications that can potentially take it away from patients that need it more in the short term. And we dealt with a lot of this. And I do think that this point is very valid. As long as there's no immediate shortage, we basically have to try to triage our drug supply as best as possible. And so, when patients come in looking for a 90-day supply, when they just got one a week ago because they heard it on Dr. Oz, no disparaging that show, it just came to mind. It just causes a little bit of a problem, for patients that actually might be totally out of that medication, or patients that might be newly diagnosed with a similar condition. So I think that's a really important point. And that's something I tried to communicate a lot to patients, that, trust us to know if you're not going to have your medication. We'll take care of you. We've always have. So, that 90-day supply ended up putting a lot of patients in the short term in a situation where they didn't have access to the meds that they needed. And the more of this is actually, the rest of this page is a lot of stuff that I think is also very useful. I mean, obviously, sounds like no brainer nowadays, but using your website or social media, that's very effective. I mean, anytime we posted something on our Facebook page, 600 plus of our patients knew what happened at the immediate time, and, they would share it with their network. So it's very valuable to try to do anything you can to just make sure your patients know what you expect of them, and keep their experience seamless so that you can focus on their care. Go ahead, next slide, please. All right, so here's where this discussion gets extremely open-ended. What I mean by this is long-term effects, question mark. I mean, the new normal of how community pharmacy is going to be practiced is very much to be determined. When thinking about this, I really tried to keep a glass half full or positive outlook. And I really like to think that this health crisis is going to result in a greater health literacy for our communities and as a nation as whole. I mean, it's a pretty sad number, but I think the most recent national adherence study, back in 2018, if I remember correctly, the average amount of patients that take their medication on a regular basis is 1 in 2. So I think that's unacceptable in a country as lucky and as blessed as ours to have medication in abundance and access to healthcare. 50% adherence is something that we should be striving for to improve as a healthcare community. So hopefully something like this actually just gets people a little bit more focused on their health, and hopefully a little bit more focused on why they need to take their medication, and why it's important to help lower the risk of other diseases, just to keep them healthy and out of the hospital. And in the short term, possibly prevent them from contracting COVID. And number 2 is goes along to the same lines. Hopefully there's going to be a greater awareness of what it takes to protect vulnerable patient bases. Unfortunately, we love to complain about living under quarantine and having to wear masks and gloves and sanitize every time we touch something, but there's a lot of patients, unfortunately, that this is an everyday existence for them. We're lucky enough to work with some CF patients up at Baker's, and I'll tell you that, the life that they live is something that is very, very similar to what we've been dealing with. And, we take for granted the fact that we can go out in public on a regular basis without a risk of contracting something terminal. And there's a lot of people that just don't have that luxury. So I think greater social awareness of something like that is something that can always be helpful. And something I'm hoping for as far as the specific drug supply chain is concerned is I'm hoping there is a shift in dependence away from foreign sources of prescription medications and PPE and emergency medical equipment. I mean, again, in 2020, there is no reason that when something like this happens, that with the manufacturing capabilities we have in this country, that we can't step up and produce the medications that we need to keep our society healthy. Unfortunately, there's a lot that goes into that, mostly dollars. But it's something that I hope that we become much more focused on as a healthcare society, and that hopefully there's a market that increases in that. And lastly, as far as the long-term role of pharmacists in our healthcare system, our role has been increasing forever, and it's going to continue to increase. We have become the source for immunizations in the country, and we only got the rights to do so to speak, maybe a handful of years back. I would say maybe 8 years or so. And now with the need for COVID testing being as extreme as it is, I mean, there are some estimates saying that we're going to require over 1 billion tests, 1 billion with a B, before we can actually get through this one season of COVID-19 in the US alone. So that's a lot of tests to administer in the way that tests have normally been administered, where you go to a diagnostic center, you go to your office and you wait in line and you take and you get some blood drawn and wait a few days for a result. That's not going to cut it in a situation like this. And I'm very happy to say that New Jersey took a huge step towards allowing pharmacists to be able to administer quick turnaround or tests that will actually give much faster results to patients right at the point of care, right at your pharmacy. So that is going to be absolutely critical to make sure patients can find out if they're immune, if they're not, are they actively carrying the disease? Are they safe to go back to work? Can they get on a plane safely? So I'm hoping that continues to grow, and I know that pharmacists are going to step into that role very, very seamlessly. Next slide, please. So this is just a quick list of some citations and resources I used to gather some information for this. I included this so you guys can check this out for your own. This is a lot of really good information and a lot of stuff that some of the CDC things and the NCPA and CPESN are right on here. So I encourage you to take a look at those. Next slide. And this is just a quick list of some ongoing studies for those that are interested in, regarding COVID-19. Something that is extremely important for healthcare workers, like pharmacy staff, is some studies going on with post-exposure prophylaxis, or a way that patients that have been most likely exposed can try to be prevented from getting reinfected. I mean, this is extremely important in the hospital setting and even obviously in the retail pharmacy setting. So if you want to check those out, please do. And obviously the two huge things that are happening right now are some really big vaccine trials. The links that you see there are actually two of the three largest, or I'm sorry, not largest, furthest along vaccine trials. The top one actually being from a German research institute, and the Faustman Lab is actually an American company that is working, I believe, in conjunction with Harvard Medical School and one other group that I apologize is escaping me. But for a complete list of every COVID-19 study in the HUE database, you can actually use the link on the bottom there. It is overwhelming. There's a lot of stuff there, but for anyone that wants to look at a much more in-depth database, you're welcome to use that. And next slide, please. And this is going to wrap it up for me here, at least in my portion. And this is just some further reading about some interesting topics if anyone wants to check this out. The first one being the NIH's treatment with an antiviral remdesivir. It was ended early, and this article explores the reasons why. Drug topics article number 2 just explains what pharmacies were doing, mostly chain pharmacies, back in March to protect staff, and the answer is really not much. And it was something that I felt was a little eye-opening, was a great read. And number 3 is obviously just how artificial intelligence actually, of all things, has been used to help speed up the vaccine research, which I thought was fascinating. And number 4 was actually an article from a British pharmaceutical society. I think it's called the Royal Pharmaceutical Society. This is their publication. But I thought it was actually pretty relatable to how we practice pharmacy in the US, and it was actually a pretty good source of information as well. So with that, I'd like to go ahead and end my section, take it to questions.
Brian, thank you so much for really elaborating on many of the things that are happening in the pharmacy world. And I think what's hitting home for many of us, both professionally and personally, as we try to access these types of services in our community. I wonder if you could share just 1 or 2 of the practices you described that you think will become our new normal, even after COVID sort of has calmed a bit in our community. What do you think will stay in place to increase patient safety and access?
Well, I can tell you that if in a situation where I had the decision, every pharmacy in the community setting would be doing some kind of adherence enhancement program, namely MedSync or refill reminder, for all the reasons I listed earlier. I mean, it just kills so many birds with the same stone that everyone really benefits. You're talking about inventory control, you're talking about better management, you're talking about giving yourself more time and better communication, more communication with your patient, more direct communication with the prescribers. And a lot of times patients find themselves in a situation where they're not only diabetic, they're not only on blood pressure medicine, they see a specialist for this, they see a specialist for that. And a lot of times you really need to take the role and the lead as a pharmacist, and those programs allow you to do that in a proactive basis as opposed to reacting as pharmacy or as patients send in requests to refill medication. So if I had to pick one, I really think MedSync or any kind of a version of adherence program is probably the thing that should become the new standard as far as community pharmacy is concerned.
Thanks. I'm going to turn it over to Tyla, who's got questions from the audience that she'll be sharing with you, and then she'll be wrapping things up. Thank you so much.
Thank you.
Great. Thanks, Kate. And yeah, we do have a question from the audience, and if folks have other questions, please type them into the chat box now. We'll do our best to answer as many as we can. The one question that we did get was, were you able to take care of all of the needs of your clients by implementing curbside pickup or home delivery?
That is a good question, actually. So yes, all of the needs is the key word there. What I mean is that we actually were lucky enough to have a beautiful like gift section, things like that in our pharmacy. And so that kind of side of it really was kind of left out. Although that being said, if our staff was asked to go shopping for a patient, we were more than glad to do that. But as far as, going to curbside model, we really focused on the needs of our patients, and it really was medication, counseling, OTCs, durable medical equipment, the medical side of our practice, the pharmacy side of our pharmacy, so to speak. And yes, we were happy to say that it did cause some hurdles, some literal barriers that we had to overcome with communication and back and forth. But yes, we are absolutely able to do that. And I think a lot of patients really, when they got over the first apprehension, really started to understand why we were doing it. And we got a lot of thank yous and things like that because they knew it was a step that we were taking to protect them.
Great, thank you. And we have a couple more minutes, so I'm going to actually throw up our slides again and share some next steps while we wait for another question or two. Just wanted to share with everybody, we did create with our partners, BioNJ and some of our pharmaceutical companies, prescription assistance guide. So that is now up on our website as of today. So it's just sharing all of the different avenues that patients can use to access financial assistance for their prescriptions. So the federal government, state government, several nonprofit organizations, a number of our pharmaceutical companies all have prescription assistance programs. So this guide will give you sort of the websites, the phone numbers, and then the eligibility requirements for those prescription assistance programs. So hopefully folks will find that valuable, and we'll share it with their networks as well. And then wanted to share also our next webinar is coming up very quickly this coming Monday. So we have the importance of physical therapy during COVID-19. So along with pharmacy and many other services, we want to make sure that patients are not avoiding care while all of this is happening, but they're continuing to access care in the safest way possible. So we have our folks from the Physical Therapy Association of New Jersey will be joining us to talk about physical therapy in the hospital, which is of course a setting that many folks are avoiding at this point, but folks in the hospital who are recovering from COVID will also need physical therapy in some cases. And then how clinicians are working hand in hand with physical therapists to make sure that their patients are getting the care that they need. And then lastly, where I think a lot of our providers are right now is how to improve those clinician-patient relationships and to make sure that folks know that they can still access care and of course can still access advice from their providers using telehealth and using other methods. And I saw that a couple questions came in while I was chatting, so we'll get to as many as we can. The New Jersey Board, I'm assuming Board of Pharmacy, issued some rules yesterday, which you had alluded to. Can you address that, and how do we get a payment model when we do testing? So are there billing codes for testing for COVID for pharmacists?
So great question. Yes, the Board of Pharmacy, well, actually it was an administrative order that came through the Board of Pharmacy that actually removed some requirements. I believe the CLIA waiver requirement was waived. Don't quote me on that, but I know for sure that the collaborative practice waiver was removed. And the reimbursement is the big question. So Medicare has actually released CPT codes as far as billing tests already. The reimbursement, I believe, I think was one, I want to say in the $40 to $50 range, depending on the actual test that's billed. The issue there lies in that on the other side, outside of Medicare, commercial and Medicaid plans, even though that there's been the intention to head in that direction, there's been very little traction. So I can tell you that as an organization, now that we have this administrative order, our very next plan is to get communicating with Medicaid and see how this reimbursement model is going to work. Luckily, I think there's enough intention in place, legislative intention, that no one that needs a test in New Jersey should have to pay for it. Eventually, commercial plans will give some kind of model. We've already been in communication with a couple of them as well. But we really want to focus on getting Medicare seamlessly reimbursable, which the federal hurdles have already been removed. And Medicaid is obviously the biggest step because a lot of patients in our state need that. They need Medicaid to be able to cover that. There's a couple different HMOs that need to get on board with the same exact plan. So the answer to your question, Frank, is we're working on it. Medicare is ahead of the rest of the game as far as commercial and Medicaid, but there's a lot yet to be ironed out, and I have a feeling the next couple of weeks we'll let that happen. So just, we will be communicating with our members definitely about the availability of tests and how to bill and so on as we, as the information becomes more available. So you're welcome to follow up on our website. We will certainly communicate anything you need to know in the future.
Great. Another great question. This is sort of a two-part question, I think. You had already mentioned some issues with supply chain and then issues with controlled substances. So are you able to deliver controlled substances to patients when they have a prescription filled, when they need, home delivery?
Yes, absolutely. As far as I'm aware, there's no law or regulation preventing home delivery of a controlled substance. And I should have gone into a little bit more than the curbside or the closed door model. We did really push delivery a lot. We already had a free delivery. I'm very happy to say that free delivery has been really a hallmark of independent pharmacy for generations. And it's something that I'm happy to say a lot of our patients that are homebound or more severely ill take advantage of, especially during a situation like this. We essentially forced it on some people that said, "Oh, well, come on down. No, stay home. We'll bring it over to you." I'm not sure if there's a more specific issue as far as delivering controlled substance that I'm unaware of, but certainly I'm not aware of any regulation that would prevent you from being able to deliver controlled substance as long as it's obviously being filled within the regulations. And I think really the general rule of thumb that we used at our store was no earlier than 2 days to the previous fill, and that really keeps you under wraps as far as what the DEA recommends and the Board of Pharmacy and obviously very, very many third-party payers and so on. So I hope that answered the question.
Great, thank you. And one last question, and one that I think we've heard from some of our pharmaceutical members, is the impact on the next flu season and the importance of getting vaccinated. If you could just speak to how you might be thinking about that or preparing for that.
Sure. So like I mentioned, pharmacists are, if not the close to the #1 source of immunizations in the country already. And, like you mentioned already, flu season coming up very quickly is going to be a problem for a couple different reasons. We're talking about two different diseases. One we're completely used to in the sense that everyone knows about the flu season, everyone knows what to expect, how they're going to feel, and one disease that is totally novel that we're still learning about on a daily basis. And it comes down to a situation where you have very, very overlapping symptomatology, but not the same kind of transmission and not the same kind of risk to the community simply because of how highly transmissible COVID is. When you have the flu, you have the flu, and you can be home, you can quarantine yourself. When you have COVID, up to as many as 40% of patients might have any clue whatsoever. And so as far as immunizations, it's really important to make sure that you're vaccinated against the influenza, and hopefully we're going to have a COVID vaccine very soon, because that at least eliminate one part of that formula. Then if you start experiencing these severe symptoms, that, most likely there's something more serious going on and you need to get tested for COVID right away. So it is extremely important, and it's going to reinforce the need for, seasonal immunizations, specifically the flu.
Great, absolutely. Well, we're just about out of time, so I just wanted to share very quickly with our audience the recording of this webinar, and Brian, your slides, if you're willing, will be on our website. It's just a short link there on the slide for all of our COVID resources. We have all of the webinars in the series listed there, as well as some other resources available on telemedicine, advanced care planning, maternity care, lots of other issues. So hope folks will check that out and find those resources valuable. So thank you. I think Kate had to hop off, but thanks to Kate for moderating. Thanks to Brian and one of our newest members, the Garden State Pharmacy owners, for a great presentation. Really appreciate it.
Thank you.
Everybody enjoyed it, and have a great day.
You too. Thank you all.
Thanks so much.